Welcome back. Part of the breast cancer journey is talking about reconstruction. Dr. Raymond Mockler is a plastic surgeon here in Panama City. Thank you so much for joining us.
Oh, you're welcome.
And let's talk a little bit about reconstruction options, because women do have options to feel whole again after breast cancer surgery.
Yes. There's certainly two types of options, using an implant, various types of implant reconstructions, or using your own tissue. And about 80% of the women will use an implant type reconstruction, about 20% will use their own autologous type reconstruction. They're the two basic groups.
And when you use your own tissue, that is called a flap procedure?
Yes.
Okay.
Yeah.
And let's talk a little bit about the implant reconstruction. And you brought some examples here.
I did.
So first you start with the expander, and that's what the expander is that you've brought. That's temporary.
Temporary, yes. Yeah, that's put at the time of the mastectomy generally, and then it gradually inflated and then switched to a permanent implant. Usually a few months later, sometimes 6 months later. Yep.
And these expanders, it's to help expand the skin after the mastectomy.
Yeah, the tissues, the skin and subcutaneous tissue,
Okay. Yeah. And then the implant, what types of implants do you have? What do you recommend usually?
Well, most women are satisfied with the silicone implants. The saline is an option in some patients, but the studies consistently show increased satisfaction with silicone implants. So usually smooth, round silicone implants at this point are the most common and the best reconstruction at this time for the implant-based reconstruction.
And you work with the individual patient to determine what's best.
Yes, that's crucial actually, is to have them come in and have a long discussion about the different options. Because there are actually, we're hitting the highlights, but there are many more subtle options in each technique. And yes, you really want to go individualize it,
And full disclosure, Dr. Mockler was my plastic surgeon when I was going through this breast cancer journey, and you really did work with me. And I remember at one point I was like, hey, let's go this route, and he was like, no, this is going to look better, it's going to fit you more, and I'm very thankful that you did that, because you did make me feel whole again.
Well, thank you very much. Yes, that's a really important part of this. It's a very stressful time, and it really try to help with all that.
Now, a lot of women have to have their nipples removed when they have the mastectomy as well. Sometimes you can do a nipple-sparing mastectomy. But if they have to have those nipples removed, let's talk a little bit about the options with that.
Well, you can do a surgical reconstruction where you recreate the bump of the nipple. That's usually followed by a tattoo. More commonly these days, a 3D tattoo is done, which really has a great cosmetic result and gives a nice finished result to the reconstruction.
And as a plastic surgeon, what brings you joy when these women are going through a difficult time, but what brings you joy?
Oh, just a satisfactory outcome. It's kind of a journey we've gone through together, and when we can wrap it up 6 or 12 months later, it's really wonderful,
And that's what he told me. He goes, it feels like a lot right now, but in 6 to 12 months, you're going to feel like a new person, and I did. Thank you for being here.
Oh, you're very welcome. Glad to support this day, actually, yes. Thank you.